as we're on the topic, what impact did restrictions and lockdowns have on normal standard vaccination programs, on other illnesses such as dengue fever, malaria, TB?
Well, this is a very important point which we do cover in the book. I mean, it's quite extraordinary. So I interviewed a colleague in Mozambique for a CG podcast I think it was in March, and at that point all of the other vaccination programs in Mozambique had stalled, and they still hadn't started up again.
And where are they now, do you know?
Some of them have started up, but it's still very hit and miss. And so, this is quite extraordinary. So basically, after 2 years after the outbreak of COVID, there was still the normal vaccination programs had not restarted in Mozambique. Yeah. So, and given that this is a condition which affects older people, effectively, and there were various reasons for this. Firstly, all the public health funds were going into the COVID vaccination programs in Mozambique. And secondly...
Why was that? Was that because...
That was to do with global health targets.
Right. So was it government directive, or was it because that was more profitable, or what?
It comes back, I think, to the things we talked about at the start about the relationship between good governance, access to funds, and public health priorities. Yeah, okay. Yeah. So that was one reason. And another reason was that the economic impact to a country like Mozambique was such that the money wasn't there to pay for the fuel for the vaccination programs to go around the various parts of rural Mozambique. So, I mean, it's
catastrophic,
staggering, really, actually staggering. And I've talked to colleagues in a number of different African countries. There are differences. Some of, Ghana, for example, apparently, the normal vaccination programs weren't really affected. But a country like Angola, again, there were serious impacts. So that's one thing. Another very important thing, which has hardly been covered at all in the press, is that malaria rapid tests. The companies which make COVID tests generally diversified from other forms of tests, including malaria rapid tests.
Because of profit.
Because there's much more money in the COVID testing programs. And obviously that was something they could do worldwide, whereas malaria tests were focusing on the African continent. So there were quite a few reports in 2020 about a real shortage of malaria rapid tests because of the diversification of COVID testing. So all of the discourse around, testing is the way out of this, it's a public duty to test yourself as much as possible, completely misses that aspect.
Yes, and how beneficial that is on a mass scale anyway.
Yeah, well,
so, on the topic, in terms of people's priorities, clearly there was a mismatch between the priorities of governments and people's priorities. And I know in your book you talk a little bit about attitudes to death and risk, and why Western nations perhaps have a different attitude to that compared with other nations, and I just wanted to sort of touch on that.
Yeah, I think that's important. Death is a part of life, as we've all, been very aware in the last few years. But I think, most people who are looking at this podcast would be aware as well that prior to that, it was definitely something which Western societies tried to keep out of the picture as much as possible. It's not.
Do you think we do that in the UK, for example? Do you think we?
I do. I mean, I'm. Nearly 50, I've never seen a dead body. I mean, that's a pretty good evidence that death is not something which is part of the life cycle, part of the way in which, not part of daily life, in a way in which it is in other cultures, and has been historically. Historically, all societies have had a very close interaction between the living and the dead. And
how do you think that may have informed our reaction to what was seen as a deadly threat?
Well, I think that's very key. The fact is, because of that, of course, because it was pushed away psychologically from many people, this was terrifying. We were told that, this was something which affected everybody was equally at risk from. Initial estimates were of a case fatality rate of 3.4%, which the WHO put out. This was terrifying for people.
Do you think, in African nations, there was a fear, a terror? Do you think the same message had the same effect?
Well, what was very interesting, not so much on the African continent, but there was one article published in the New Left Review in March, April 2020 about the situation in India by somebody who, very interestingly, at that point, already was writing under a pseudonym.
Yes.
This person said that it was clear that, poorer people in India did not see COVID as a catastrophe. What they saw as a catastrophe was a lockdown. And then what they were scared of was not COVID. They were scared of the impacts of the lockdown.
Yeah. I remember in your book, I think one commentator anonymously put, there was no lockdown, it was poorer people delivering goods to richer people. We didn't know, we didn't have.
Well, I mean, that was in the Western dimension. So I mean, that brings us on to that aspect. You know, obviously coming back to your original question, Lucy. I mean, there's so much we could talk about, but why did I get interested? That was where I started, but of course, very quickly I became aware of the dimensions, you know, in Britain and elsewhere in Western countries, saw that with my own children, for example, some of their friends, my older daughter, 2 of her friends developed eating disorders during the first lockdown, for example.
Eating disorders have risen, spiralled up by 8 times, I think.
Yeah.